This is so exciting, folks, because while the world's attention has been so heavily focused on COVID-19, researchers here still so busy working on cancer tests and treatments, and a new blood test developed in Cleveland at the Cleveland Clinic could be a game changer. And Dr. Eric Klein of the Glickman Urological and Kidney Institute joins us now live with more on this test, why it's so important. Doctor, it is a true honor to have you with us here on Fox 8. Thanks for joining us today.
Thank you for having me.
So tell us about this new test and how it can save lives.
This is really very exciting. We know that cancers are most easily cured when they're detected early. And there are lots of cancers for which we don't have good early detection tests. So we have, mammography for breast cancer and colonoscopy for colon and PSA for prostate, but there are a lot of other cancers where we don't have that. And so this test is being developed to address that. And let me just clear up one misconception is that this was part of a multi-center study led by a company called GRAIL. So this wasn't specifically developed by.
Okay, thanks for clearing that up. But you guys are working on that and testing it. Is it a blood test?
It's a simple blood test that uses the same technology that was used to sequence the human genome. It's called next-generation sequencing. And what it does is detects little bits of DNA that tumor cells shed into the bloodstream. And the blood test and this technology can detect minute amounts of these molecules and determine if someone might have a cancer.
So, doctor, what kind of cancers are we talking about? And would this become possibly some kind of routine blood test that we would get when we just have a physical, or do you have to show some kind of symptoms when doctors are trying to explore everything and find out what's going on?
Yeah, great question. So the answer to the first question is that this detected more than 50 different kinds of cancer.
Wow.
It works best for 12 fairly common cancers: ovarian cancer, pancreas, that sort of thing, that account for many deaths. Ultimately, we see this as potentially a routine screening test for interested patients who are at risk for cancer by virtue of age, who are known inherited genetic syndromes and that sort of thing. So, yeah, and in a number of years, this could be a routine part of medical practice, is to have a cancer screening test like this done once a year or so.
Incredible. Doctor, you mentioned two cancers right off the top. You said pancreatic cancer, ovarian cancer. Those are two of the most deadly cancers, especially too because the symptoms don't start until it's so aggressive and it's so far down the line. So does this seem like, when we say game changer, because you're catching it early before these symptoms start really breaking down a person's body, that it truly could save lives, right?
Yes, that's exactly the idea. We think that this test will detect many, probably not all, but many of those sorts of cancers that do present at later stages, at a much earlier stage when they can be treated and cured. That's the hope.
It's fascinating. So we know a lot of times there's clinical trials, there's a lot of red tape. Sometimes it can take years to get this stuff passed. What's the process right now? How soon can we get this out there and readily available?
So the study we just published was in 15,000 patients, which is quite large, and was a discovery study. So now there are ongoing trials to test this in the general population where we don't know who has cancer, who doesn't, that sort of thing. Still probably a couple years away.
Fascinating stuff. Thank you, Dr. Klein, for being with us today and sharing this hopeful news for so many people, as we keep saying, why can't we find a cure or better testing? And this is truly remarkable. Thanks so much. We really appreciate it, and keep us posted on everything.
Thank you.
Have a good day. Be well. Thanks, doctor.